My name is Dr. Michael Seiberg, and today we're going to talk about bunion deformities. A bunion is a crooked big toe joint. A lot of people feel that it's caused from tight shoes or that they maybe did something that caused the bunion, but generally it's hereditary. You'll see bunions running in families. Bunions may or may not be painful. Fortunately, out here in the desert, we have the option of wearing sandals for much of the year. So patients may have bunions, but may not have pain. Bunions are addressed surgically for patients that have chronic pain and unable to wear many types of shoes comfortably. A bunionectomy is generally performed as an outpatient procedure. A lot of patients are kind of fearful of having a bunion surgery. They've heard it's a very painful surgery and a long recovery, and that's not necessarily so. There's newer techniques in fixating a bunion and correcting the deformity. The goal of the surgery is to remove the bunion, but also to realign the joint and straighten the toe so there's less of a chance of it recurring as we get older. Surgery is done as an outpatient. Generally, the bone's cut, may have to be moved over. There may be a screw or a pin involved temporarily. Patients usually can walk on the surgery afterwards with a boot or a postoperative shoe, which looks like a sandal, and the recovery is usually about 6 weeks. But most patients do fine. They don't have to change their lifestyle. They don't have to be bedridden or necessarily give up their job, depending on what kind of work they do. Bunions can be on one side or both feet. Most patients come in, they have more pain on one side, but they may be developing it on both feet. The question is, if they're both painful, do you do them together or you do them separately? And it's up to the patient. Many times the surgery can be done at the same time, have both feet done at the same time, especially if it's a type of surgery where they can walk on after the procedure. Now, some patients would rather just have surgery once and be done with it, rather than having two separate surgeries and recovering from each one. Sometimes if the surgery is going to be a larger procedure because the patient has a bigger bunion deformity, they may need to be non-weight bearing after the surgery. And in that case, we wouldn't advise doing both at the same time, both feet, due to the fact that you'd have to be non-weight bearing and essentially being in a wheelchair for 6 weeks. So those patients would choose to do one foot at a time.